What causes hunchback in the elderly? Hunchback can be considered an outdated term, as it's referencing to a spinal condition that causes the upper back and shoulders to round excessively. The correct term is something called hyperkyphosis, or short, kyphosis. A kyphosis refers to a spinal curvature that bends to the back of the body. And kyphosis can be healthy if it falls within a normal range in the thoracic spine. Or it can be problematic if it's excessive, if it becomes too big, or it can become too small where it's something called hypokyphosis. But on this video, we're going to be focusing on hyperkyphosis. And hyperkyphosis affects the thoracic spine, and a normal range is somewhere between 20 and 40 degrees. Hyperkyphosis is commonly diagnosed when somebody starts to break 45 to 50 degrees of kyphosis in the thoracic spine. There is another type of kyphosis that you can develop that's also abnormal, and that's when you develop a kyphosis in the cervical spine or lumbar spine, because these areas of spine should have something called a lordosis. But like I mentioned, what we're focusing on this video is hyperkyphosis of the thoracic spine, because this is the most common presentation we tend to see in elderly. The main symptom of kyphosis or hyperkyphosis is a rounded back, what we call hunchback appearance, and this upper back develops a noticeable arch. Kyphosis can have varying levels of back pain, but one thing that's in common with kyphosis, typically in the elderly, is something that we call spinal rigidity, where there's the limited ability to extend the mid-back. Tight muscles along the anterior portion of the torso, and normally a lot of tight leg muscles and hamstrings. And typically we'll see a flexed knee appearance, where their knees are bent and they're kind of tilted forward some. There may be breathing and digestive issues as well in severe cases, but most commonly what we're seeing is this type of appearance with associated stiffness and back pain. Now, the causes of kyphosis in the elderly can be very widespread. It can be chronic poor posture that really occurred early on in life and was remained uncorrected, and it causes spinal cord tension within the body, leading to pain and discomfort, can lead to this excessive kyphosis. There could be structural abnormalities within the spine itself. There could be spinal injuries and trauma, and these can include things like compression fractures or traumas within the spine as patients go through aging throughout their life. There also could be degenerative changes of the spine, meaning bone spurs and bone degeneration and disc degeneration that can lead to kyphosis developing in the thoracic spine. When we look at kyphosis, we want to define it as two different types. Something that's called a postural scoliosis, and this is called by poor posture and isn't so structural, meaning that the patient can still extend the thoracic spine and kind of correct it. The second type is something that we call a structural kyphosis. And a structural kyphosis, normally a person can extend the spine and can correct it. Other types of structural kyphosis may be a postural kyphosis that has converted to a structural one. However, we do have types that start off as a structural type. And this is something called Sherman's kyphosis. And this is where during growth, the vertebral bodies of the thoracic spine developed an excessive curvature, and also something called congenital kyphosis. And these are babies that are born with a malformed spine in utero that can lead to a structural kyphosis from birth. Regardless of the type, most cases of kyphosis is treated in elderly by really improving posture, shape of the torso, the size of the kyphosis, and decreasing pain. First thing, you must determine whether this kyphosis is truly structural or postural. Unfortunately, most elderly patients have a structural component to their kyphosis. So just trying to do lifestyle changes isn't enough. There must be a structural component, a structural therapy that's addressing the structural component. And this typically involves physical therapy, chiropractic care, potentially bracing, exercises, and they're much more complex to treat. If it is truly a Sherman's kyphosis that's been there, then it's definitely going to involve this. However, other types that maybe involve compression fractures or degeneration may have to have this, and maybe potentially some other types of treatments associated with it, depending on the type of kyphosis that exists. So we know the symptoms of kyphosis is by presenting with the shape and the severities measured in terms of the degrees of the kyphosis that exist. what I would recommend, if there's a kyphosis developing, you want to treat it as soon as possible. And if you're ready in your elderly years and you're seeing this kyphosis develop, the sooner you treat it, the better, because it can really affect the quality of your life, really start to affect your ability to stand and walk and really enjoy your later years of life. So it's something that you want to address very soon, because as it starts off postural, it becomes more structural and it becomes more complicated. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.